Meanwhile, nursing union DENOSA is urging governments and employers to adopt the International Council of Nurses' 10 policy actions to salvage the country's fast-ailing healthcare system. The union held a nationwide event to celebrate healthcare workers. This is what nurses had to say about the day.
For me, International Nurses Day is the celebration of nurses, of what we do as nurses. We get to remember why we became nurses in the first place. And how are we changing nursing moving forward?
The country is currently back to fully operational and fully opened. We can then therefore say nurses of South Africa have emerged victoriously from the difficulties of COVID-19, as it were.
Let's take you further now with DENOSA's General Secretary, Kwena Manamela, joining us. A very good evening to you. Thank you so much for your time. Happy International Nurses Day. How have you reflected? I mean, we've heard some of your colleagues speaking about how today was essentially a celebration of nursing and remembering why one becomes a nurse to begin with.
Good evening to you and the viewers at home. We are very happy today that it is what we can call a birthday for the nurses worldwide. We are very happy that our government has also come on board this time around because alone, I think together we can do more as a country, celebrating the day together, recognizing the work that the nurses have done. I think my colleagues have already reflected where we're coming from. We're never the same as a country and as nurses after COVID-19. I think it has taught us a lot of things, that there is a lot that we need to do. I think one of the things that the International Council of Nurses reflected in their Charter for Change, I think in a summary, is that we should value, protect, respect, and invest in this cadre. A nurse that is very important. We have seen that they form the majority of the healthcare force, and if they are not well taken care of and we are not investing in them, I think we will not go very far as a country in terms of transforming the health system and also delivering the more needed care that the country needs. But we're very glad that today, in most of the provinces, there were some celebrations, and we got reports that they went very well. I think it's around in, if not all provinces, but I know the other provinces are still going to, they've postponed, they're going to celebrate it later. But today is the day because it's the day of the birthday of what we can call the pioneer of modern nursing, Florence Nightingale. He was born on the 12th of May. So is actually celebrating this day and also tracing back the evolution of nursing, where we're coming from and where we are currently as nursing, whether we're still relevant to the community that we serve and whether we are at par with the disease burden that is currently we are faced with. But I think we are generally glad that we revived the nurses today and recognizing them. I know in some of the provinces they were even awarding the best of the nurses some awards today in some of the provinces.
Yeah.
But although we're saying there are some of the challenges that we're still facing as a country, and I think working together, the way I saw we ourselves working together going forward, I think we can defeat most of the challenges that we have, especially the one of the shortage is there, and there are nurses that are there that are unemployed. There is a number of nurses that are unemployed. We are not even aware that we've got over 20,000 nurses in the country that are unemployed, whereas we are having around 16,000 shortage of nurses. That is a shock. It was just our preliminary investigation that we have done. So we were shocked by that, but I think governments hearing or provinces hearing what we are saying, they will pull their socks and try to employ those nurses that have done their community
Let me ask you this.
service.
Where do you think the problem lies in South Africa when it comes to the nurse shortages? Is it a shortage of nursing schools? Is the career not attractive to new entrants? Where's the challenge?
Where I am now. I'm a little bit confused because, like I said, there are nurses that do community service and they are not employed. They sit at home and they accumulate because for the past, I think, 3-4 years, in some of the provinces, there were nurses that were trained. They did community service. They were not absorbed. So, and training goes on and on and on. And at the same time, we are complaining as a country to say we've got a shortage. So these two things, when you try to match them, sometimes they may not make sense. I'm sitting here, I'm trying to make sense of what I'm talking about. Because if the shortage is around 16,000 and you've got around 20,000 nurses that are sitting at home, what is it that we're talking about here? It means now all the vacant positions that are there, government have got to do something about it, prioritize those positions, and employ those nurses in those positions. And let's see how many will we still have out of the ones that we did a preliminary investigation on that are sitting at home and are not employed.
Yeah.
Because we've got a view now that the government might be abusing these people. They do community service, they sit at home. They know that come the next year, they will have community service nurses that will continue doing the service. But those that have completed, they are no longer taken care of. That is the challenge that we are having.
Very well. Thank you so much for reflecting. Of course, we're going to have to leave it there for now.